Yes, and we're back here in WhatsApp. Of course, together with me is my co-host, no other than Dr. Rayran Lao, and of course our guests, together with the icons in dental medicine.
Yes, Dr. Carlos Buendia.
Dr. Carlos Buendia, and we have our new guest, of course, Dr.
Jaime Lapan
Jaime Lapan is
Jr.
also a resident in oromaxillofacial. Yes,
Okay, and
who's also a resident in oromaxillofacial surgery. And Dr.
Eduardo Olea Jr. or Doc EJ.
Doc EJ, also a resident in oral maxillofacial surgery at Mary Charles Hospital. Okay, now we have a texter, Dr. Lao. Can you read it?
Yes, with a cell phone ending at 3540. Doctor, can you please give us an idea how much is a dental implant would cost? Example, for a second molar tooth. Salamat po from Lani of Sampaloc, Manila.
Alam mo, dito kasi we have several patients really very interested about our topic, especially the dental implants. Ako, all the while, I thought that dental implants will take me like 2 weeks, 4 weeks to have my, vacant tooth, I can say. But right now, mukhang nagkaroon ako ng idea, Dr. Buendia. Bigyan mo lang ako ng discount. So they're asking, ano ba ang range? Range na lang at how much is the procedure for dental implants, Dr. Buendia?
Well, when we say dental implants, ganito po yun eh. Marami yung system eh. We have the Koreans, we have the US, we have the Germans. So,
may ganun din, ha?
yes.
May
So,
mga,
dito ho
kung ano ba gusto mo?
Yes.
Ay, made in Korea, made in US.
Talaga, oh.
Kung made in China kaya, mas mura, no?
Meron ding mga
Pero ano yung pinaka most popular na rene-request sa inyo, sir, ng mga patients?
Of course, we use the Swiss made,
The
German
best is
made.
the best.
Yes,
Okay.
yes. Meron din, I won't be mentioning the
brands.
brands.
Okay.
There are Swiss made, German made, US made also.
So it will depend upon where it is made.
Yes,
Oh.
yes, yes.
Okay. So when you say made on buo, ito ba, let's say kung made in Japan, mas mahina ba to or
Not necessarily. Hindi naman po, hindi naman.
okay.
Because they're all made up of titanium. Sabi ko nga sa
Titanium.
So
inyo
yung
kanina,
brand lang po,
So
sir?
no,
lang.
you cannot choose
Oh,
any
okay.
other metal except titanium.
Yes, yes.
Brand lang ang
Brand lang. Kasi nga, minsan, siyempre, pag sinabi natin Korea, yung manufacture cost nila medyo mababa. Kung sa Amerika, medyo mataas yung manufacture cost. Doon nagkakaroon ng variation.
kay Lani ng Sampaloc, Manila, pag nagpa-consult kayo kay Dr.
You
mamimili po kayo.
You ask the brand.
Yes,
You ask the
yes.
brand.
Ano
is
ba
it
ang,
made?
there was a question, ano daw ang qualification to become a resident in oral maxillofacial? How did you enter
Kailangan
into
ba
the training
graduate ka
program?
ng dentistry?
Yes.
Or may
Dr.
pwede mag-lateral entry?
Dr. Lapan.
Yes. Definitely you have to be a graduate of dental medicine first. Tapos you can apply sa Mary Charles Hospital to become a resident.
For example, Doc Bogs, kunyari, doctor, medical doctor, pwede ba mag-training
Mag-training
sa
ng
oral and
maxillofacial?
maxillofacial surgery?
No, because the requirement is you should be a dentist. Even in the United States, the maxillofacial surgeons are dentists.
Okay.
I want because oral and maxillofacial surgery is a 2-year subject in our curriculum.
Okay.
Yun ho ang kasi hindi alam na iba eh. And the curriculum of dentistry follows the American pattern.
Okay.
Wherein the basic medical subjects are already incorporated in the curriculum. That's all we need. Ngayon sabi nga sa Europe naman, 2-degree holders sila. I know because I've been there. The medicine takes you only 6 years. And when you go dentistry, another 3 years. So in 9 years, you were able to finish 2 courses, medicine and dentistry. Dito lang kasi, yung nga, ginaya natin yung American pattern. The curriculum is based on the American pattern. The basic medical subjects are already incorporated, then you have the dental subjects. That's all we need. Yan lang po kailangan natin.
How about, let's say, it's just, does the training in oral maxillofacial surgery is the same like the training in general surgery where you have to stay in the hospital?
Yes.
Or you have to stay in your office and wait for a call if there is any other form of surgery?
Now,
or any
actually,
surgical
the
procedures?
formal residency training program, yun nga, sinasabi, just like in medicine, 24/7, but we made a program that is suited for private practitioners. Kasi tinitingnan din po natin yung mga private practitioners, may mga pamilya,
Oo.
ganyan. Siyempre, paano sila mabubuhay?
Yeah, kasi siyempre they have to survive.
Yes, yes.
So they could practice naman the
Yes.
general dentistry.
Yes, outside.
Okay.
May hanging question pala tayo, Dr. Cenica, kanina,
Yes,
no?
oh.
Yung teeth
Whitening.
whitening.
Yan,
Oh,
alam mo,
sige.
kasi kung usong-usong ngayon yung skin whitening or bleaching, meron din sigurong skin
Yes,
teeth
ma'am.
Di, actually,
bleaching
kunyari
or...
nagpapagluta ka, pumuti ka.
Oo.
At yung ngipin mo hindi maputi. Yun ang problema.
maganda
Siguro,
yun.
Dr.
Pero
Alay,
ang luta ba nakaputi rin ng ngipin?
tatanong natin.
Sakali, no?
Dr. Alea, paano ba itong mga tooth whitening?
Yeah, tooth whitening.
Actually, when it comes to tooth whitening, marami kasi procedures dyan. May
Okay.
mga sa bahay lang yung over the counter
Alter.
na
Take home.
nilalagay sa take home. Meron din on the procedure itself sa dental clinic, yung lasers.
Lasers.
Yeah.
So,
We
paano
do
nakakaputi
lasers.
ng ngipin ng isang
Ang laser.
laser?
Actually, yung laser, what they do is actually, ang ginagawa is, ino-open niya yung mga dentinal tubules. Wherein, after na i-open, nag-encroach doon yung parang whitening na ipapahid mo.
Oh,
Na may
mapahid ka.
content na hydrogen peroxide.
Hydrogen
So,
peroxide.
parang gumagawa ka ng channel.
Yeah.
Yeah, you
Yung
open
ba
up
yung
the channel.
You
Open up the channel.
and
Para
then you put...
ma-penetrate.
yes.
What does a
Ma-penetrate.
hydrogen peroxide do to make it white?
Actually, inaano niya yung crystal sa loob kasi microscopically speaking, yung kanyang content, no, it can actually penetrate yung mismong dentin. Kasi the dentin gives the color of the tooth. Not yung nakikita nating first layer which is the enamel. It's actually the dentin that gives the color of the tooth. So, pinipilit nating makapasok siya yung hydrogen peroxide and actually minamanipulate niya doon yung color ng dentin.
There will be a lot of really televiewers right now who will
Yes.
be interested
So,
in
sana wag pong gawin
dental
na
whitening.
yung hydrogen peroxide ipahid, no? Baka
Ipahid,
may mga
oo.
pasyente
Baka may
na...
imumog o whatsoever.
yes, bawal
Hindi ba
po yun.
nakakaputi
Yes,
yun? Kung
oo.
let's say, imumumog mo na lang yung hydrogen peroxide. Hindi.
No.
Baka pati yung gums mo pumuti.
Di ba? Hindi. Does it say it will also cure some, they have like a gum problem? Hindi ba?
Yeah,
Di ba masama?
actually,
Yes.
Protect the gums.
we do use yung hydrogen peroxide for some dental procedures,
Yes,
like
yes.
root canal therapy and everything. Now, yung iba, if you can see yung packaging ng hydrogen peroxide, meron sila doon for mouthwash. Pwede mo siyang
okay,
gamitin.
meron talaga. I told you.
Pero definitely not pure.
Okay, good,
Do not
good,
use
yes.
it pure.
Yung pure.
You have
Kumbaga
to
yung
dilute.
talaga naka-dilute.
Diluted.
Diluted
Pero
sa
pwede.
water. Pwede. Pwede siya kasi
Siguro
ano,
mamaya, Dr.
Doc
Lao.
Bogs, kunyari may singaw ka, pwede ba ito, yung sinasabi niya na mouthwash na hydrogen peroxide?
it could help pero hindi siya talaga treatment for singaw eh. Singaw kasi parang ang anatomy ng singaw is it has a covering doon sa mismong sugat so hindi makapenetrate yung gamot.
Oh,
You have to remove the covering first before you can penetrate yung mismong target area.
Oh,
So you have to have yung mga certain medications for that.
oh.
Yeah.
Hindi
Dr. Bendia, ako na mina-obserbahan ko, especially sa mga showbiz, no, na ang puputi ng ngipin nila. Pero nag-iba yung parang setup ng ngipin, parang naglagay sila ng jacket all over the teeth to make it white, no? I don't want to say who are these showbiz. Even I have also some patients. Sabi ko, ba't pumuti yung ngipin mo? Pero ang pagputi ng ngipin nila is just like parang masyadong maputi. Hindi magandang tingnan. Dr. Bendia, can you comment on that?
Some dentists do laminates. They place
Laminate, yun.
Lalagyan ng laminates eh.
Nila-laminate.
So,
Hindi
parang-
yan ang tinatawag.
Oh,
okay.
veneer.
So it
Veneer.
covers.
Is it permanent? Permanent ba
It's
itong veneer?
permanently cemented into the tooth crown. Nakasemento ho yun.
Ano, do you have to chisel out the teeth and then you put the
Yes, we do some grinding of the tooth enamel.
hindi ba masama sa ngipin yun? Pag
Hindi
ganun?
naman. Very minimal lang naman.
Hindi ba natatanggal yun? Let's say, for example, if you go abroad, tapos biglang natanggal yung pinaka-veneers. Pangit, di ba?
Depende na ho yun sa composite na gagamitin.
Oh, okay.
Composite.
So, maganda pa nun. You have a texter from cellphone number ending at 8169, Dr. Lao.
Yes. How do you do a full denture implant and ito ulit? And how much does it cost?
There's a lot of people
Yeah.
right now, you have a lot of clients or
Siguro,
patients who wants to have a dental
ballpark para may
Imagine,
idea.
Dr. Lau, 15 minutes, you got a new teeth.
Yes.
You don't need to be, bihira na ngayon na
And
nagpapalagay
kinabukasan,
ng false
pwede ka
teeth
nang,
eh.
you could do, you could resume your activities
Correct,
kinabukasan.
yes.
Oo.
So, how much, let's say, a full dental
Yan ho sinasang 15 minutes. That's per fixture.
perfecture?
Not the whole procedure.
No, not
Yes,
yet,
yes,
definitely,
yes,
yes. oo.
But for the full mouth, Hindi mo na mas common sinabi yung we have 32 sets of teeth.
32 na ilalagay sa'yo.
Hindi.
Oh, okay.
Tinitingnan ho namin yung exact. May mga distance kami chinecheck. Kinoconsider talaga.
Okay.
Para to make a fixed bridge out of the dental implant.
Can you give an estimate,
Estimate.
Dr.
Let's say,
Aloy?
hindi, siguro per tooth yan, no? Per procedure.
Yeah, per tooth.
Siguro per tooth na lang.
Oh.
Sila na ang
Per tooth,
mag-compute.
let's say,
Para yung mga pasyente magkaroon ng
Sila na
idea.
mag-compute po.
Pwede.
sabi ko nga, depende nga sa where it is made. 60 to 100,000, mga ganyan. Diyan siya nagre-range.
Okay.
To include the prosthetic side.
60 to 100,000.
Pero meron pa nga mga iba,
So
nagcha-charge
parang
sa mas
halaga lang
mataas
ng
pa.
isang high-end na cellular phone.
Yes, meron pa nga iba talaga nagcha-charge higher pa.
Ah.
Depende na rin minsan sa practitioner eh. Yung mga
Ayun.
practitioner
Si
talaga.
Dr. Benji, alam niyo yan, ay
Hindi yun.
napaka-generous niya kasama ko yan sa Rotary Club of Manila. At siya talaga nagbibigay ng mga charity services. Ayan. Especially sa mga pasyenteng hindi nakakaabot kaya, pero pwede nyo lapitan si
Pag pupunta
Dr.
po kayo
Benji.
kay Dr. Bindi, huwag po kayo mag-BS na maayos.
Yeah.
Kasi maawain po si Dr. Bindi.
Hindi, si Dr. Benji talaga ano yan. Kasama ko sa Rotary Club of Manila for almost 10 years na tayo, no? Pero we are really doing a lot of medical missions. One time, pupunta pa kami yung, I remember yung USS Mercy, na yun yung para bang ship hospital. At si Dr. Bendia ay nasa military career also. He's one of the head of the reserve
Force component.
reserve force component ng Armed Forces of the Philippines. Now, paano nyo naman for the doctors, no? How did you know Dr. Bendia bakit marami naman mga doctors na nagtitrain dyan eh? Why Dr. Bendia? Ano bang nakikita nyo sa kanya? Ayan.
Actually, the
Gandang
first,
lalaki? Ano ba?
Kasama siguro.
aside
yun.
from that, actually, I came across Dr. Bindia by accident lang eh. No, kasi hindi siya nag-advertise
Nabangga yung kotse mo sa
No,
kotse niya?
actually,
Parang ganun.
hindi unfortunate accident.
Sige.
By accident lang, na someone told me about yung ganon. Ako kasi, in practice ko, I'm more on sa surgery side eh. That's my parang, yun talaga yung gusto ko.
Dream. Yun ang
Surgery,
dream mo talaga
yes.
surgery. Okay.
Yes. So, somebody told me that Dr. Bindia is parang offering yung ganon. So,
Training.
I inquired. I asked for his number. Tapos yun, I inquired. So, that's what he told me. Yung mga conditions, everything, how many times a week, or how many times, or gaano katagal, ganyan. So, yun, nung sinabi niya sa akin lahat, I thought about it and nag-jive naman dun sa mga, kumbaga, requirements ko.
Stricto ba si Dr.
Strict to ba si Dr.
Caloy?
Bendia?
No, yun
No,
yung,
wow.
that's a good thing about kay Dr. Bindia.
Alam mo, Dr. Lao, si Dr. Bendia is the Executive Vice President of the Philippine Dental Association.
Yes.
Alam mo, sa mga organisasyon, yung Executive Vice President o Vice President, after a while, parang siya yung nagiging presidente eh, no? Parang gano'n yung dating eh.
May
diba?
mga,
Kaya napakaswerte
may mga
natin na
trending,
nag-guest natin ng
may mga
Vice
trend na
President.
ganoon.
ng
There's no
Philippine
way to go but up.
ako nung bago ako naging presidente ng Philippine Academy of Aesthetic Surgery, naging vice president muna ako noon.
Ayun.
Pero pag siyempre lahat ng mga trabaho ng presidente, alam mo na. Kaya yung mga vice president, nagiging presidente eh. Ayan. Si Dr. Olea, okay, let's go back again dun sa skin whitening. Any other procedures that other than these lasers that could make a teeth white?
Other procedures like halimbawa kasi usually nung mga nagpapa-teeth whitening. Actually, when it comes to teeth whitening, it is on the patient's kumbaga choice niya eh. Like halimbawa during the procedure, when halimbawa parang napansin ng patient na my teeth is not that white and I wanted it to be whiter. So, it depends kung gaano kalaking degree. But there are cases like halimbawa after undergoing RCT or what we call the root canal therapy, minsan nagkakaroon ng nagdi-discolor yung teeth. And we have what we call the internal whitening. In that way, we actually incorporate the whitening solution inside the tooth. Since the RCT procedure, it's a tooth na lang, non-vital na siya. Ang tendency is we incorporate the material inside the tooth.
Ayun.
Doon yung ginagawa sa
Of course.
Okay, so
napakaganda,
napakaganda ng
no?
topic natin, no?
Meron pa tayo, alas yung hindi natin na-discuss, yung braces eh. No?
Yes.
Which is a very common problem ngayon sa let's probably make a short comment, Dr. Bendia. Who are the patients who are candidates for braces.
And what age, sir,
Very
pwede silang
short, one sentence.
yes.
Yes.
Any patient who has a malaligned tooth are candidate for braces.
Malalain to.
Malalain.
Okay.
From 13 years old up.
13 years old up.
Okay.
Even a 70 years old, sir, pwede magpa-brace?
Yes.
Yes.
How about dental implants? Who are yung age bracket nila? Dr. Lapan.
As they have to be adults.
Adults,
18 and
okay.
above.
18
Kasi
and above.
yung changes sa skeletal structure ng pasyente, you have to consider also na lumalaki
About
pa ba
skin
yung
whitening, anong age pwede?
Teeth whitening, syempre, ganun din. 18 and above
18 and
usually. Once na andoon na lahat ng permanent na ngipin.
So how can we prevent to have like a general to the game, hindi tayo mabunutan ng ngipin? I mean, ngayon kasi alam ko, mga dentist ayaw na magbunot no? As much as
Correct.
possible, oo.
Well, yung it goes down to yung checkup, regular checkup.
Regular
Every 6
checkup,
months
correct.
usually ang talagang suggested na time of
Okay.
visiting the
Siguro
dentist.
doctors, we can summarize it into four
Yeah.
dental tips. No?
Sige.
This
Okay,
is the
good.
four
Sige,
common
for
dental
our
tips.
televiewer.
So,
Itong ating camera, tumingin
yes.
ka. Ayan.
So first is actually to always brush your teeth 3
Okay.
times a day, of
Yes.
3
course.
times a day.
Every after meal.
Okay.
The next is you have to eat healthy foods.
Okay.
Kasi
Number
syempre
2.
it contributes.
Okay.
Number 3 is to use toothpaste with fluoride.
Fluoride.
Fluoride,
Okay.
okay.
Any brand basta with fluoride,
Yes.
okay?
Alright,
And
okay.
lastly, visit your dentist twice a year or every
Twice a year
6
lang.
months.
Oh,
So when we want to visit you, where can we find you, Dr.
Yes,
Olea?
Mm.
Yeah.
Ayan.
Can you give your telephone number and address?
So first, of course, we are resident of the Mary Child's
Mary Child's
Hospital.
Okay.
So you can visit us there. And for our private practice, I'm practicing at Muntinlupa and
Muntinlupa.
Hospital ng Muntinlupa.
Oh, okay.
How
Thank you very
about,
much. Well said, Dr. Lapan.
Lapan?
Dr. Lapan, I practice in Imus, Cavite.
Imus,
My
Cavite.
clinic is in
Mga
Imus,
taga Cavite,
Cavite.
magandang lalaki talaga eh. Oo, from Kawit ako eh. Yan.
Okay. So there, ang number ko is 0917
Yes.
503-9210.
Oo,
Okay, that's for
maraming
Bogs Lapan.
tatawag sa'yo. Dr. Bendia?
Marami ho kasi
May
ako
colleague.
iniikutang ospital.
Yeah.
Hospital, ho.
Yes, yes, yes. Oh, hospital-based, no?
Hospital-based, Mary Charles, you can see me there.
Okay, Mary
Tagay,
Charles.
UniHealth, Tagaytay Hospital and
UniHealth
Medical
Tagaytay.
UniHealth Tagaytay.
Yes, oo.
Tapos visiting ako ng mga ibang maraming
How about your primary clinic?
I have a clinic in Lacson.
Yes.
Meron din ho sa
Meron po
Tagaytay
bang
Hospital and
landline yun,
Medical
sir? Yung sa
Center.
Lacson,
Landline, so para
where can they
matawagan ka,
contact?
mamaya sigurado maraming doktor, maraming pasyente.
781-9760.
781-9760. Dr. Kaloy Buendia.
How about you, Dr. Lao?
Yes, you can see me at Janssen Cosmetic Surgery at number 8, Acropolis Building in Libis, Quezon City. Our telephone number is 667-3491. Again, it's 667-3491.
Yes, and you can log on at our Facebook at Johnson Cosmetic Surgery, and our clinic is in Manila, 233 second floor Midland Plaza, of course in Quezon City, and also in Angeles City at Balibago. You
Balibago
can look
Highway,
for
yes.
Dr. Kililan, sila
Dr. Dalisay, Dr.
Nordel,
Fernando,
Dr.
Hans
Dalisay.
Nordel,
I would like to thank
yes.
Dr. Dalisay for the music. For
Yes,
What's Up,
nagpapabati
Doc.
pala Dr. Cenica si Justice Dimagiba. Yes.
Justice Dimagib. Ay,
Yes, so,
magandang
nanonood sa atin ngayon.
umaga po. At binabati ko rin si Justin.
Justin
yung
naman.
anak ko naman. At of course, together with us is our Dr. Dapal pala, and Dr. Hobayan with us, who are also residents of Johnson Cosmetic Surgery. And you can log on also www.johnsoncosmeticsurgery.com. You can call 521-1444 and 526-6297. Of course, this is Dr. John Cenica and Dr. Rayran Lao for another episode of What's Up, Doc?
Sir, thank you.
There's a tear in your eyes, I know. I can feel that it's not been dried out.